Hello and welcome to The Rightest Leftist with Nathan Ogilvie, the podcast for the politically homeless. In this episode, we're going to be continuing the series from my previous episode about mental health in Australia. And in this episode particularly, we're going to be looking at the mental health policies of the major political parties. Because when it comes to funding mental health, the government has a key role in that. And as I talked about in the last video, in terms of the mental health system being a mess, there is so much complexity in the system. And I totally recognize that and don't want to come across as being a doomsdayer saying that the system is broken and there's nothing we can do. My position is the system is broken, but there is a lot that we can do. And you might be surprised if I just sort of, in all the knowledge you might have of the political parties, or if you've watched my videos with my opinions on the political parties, I'm going to keep that out of the video for this time and just look at it purely through the lens of their mental health policies. And that's through the federal election that happened this year because all the parties announced their policies. So I'm going to go through those and we can take a look at what each party offered. Obviously, the Labor government is in charge now and will be federally, across Australia, the ones rolling out their plan. And part of what I'm going to be doing with this series that I'm going to do, there'll be 3 parts. This is a 2-part, second of the third part. And then I will be continuing to track it though, especially with Labor and their progress tracker for their current 3-year term. I'll be following closely the actions that they take compared to their plan for mental health. And so what we're going to do now is just want to highlight the extent of the crisis. This is the Australian Psychological Society, or the APS for short. There was an article that was featured in the Herald Sun. This was from March this year. And really the key point is right there, that 1 in 3 Aussies are battling regularly, feeling drained and burned out. And that's just the tip of the iceberg in what the findings found. And me being an expert in mental health as a psychologist, and any expert that tangentially works in the mental health field, and that goes from nurses in hospitals to police officers, so many everyday Aussies who work in any kind of field related to mental health, or if you just know a friend or a family member who's struggling with their mental health, the system is overwhelmed and it needs a fix. And the thing is, I'm not going to say it's not that hard to fix, but there is some really basic changes that can be made and things that can be done. And the way I'm going to look at it in this video is through the different political parties. So we'll start with my former party that I left, the Greens, their policies on mental health. Now, the Greens have a lot of detail on their mental health care plan. I'll start with the biggest criticism, that a lot of it might seem unrealistic or might not be able to be implemented. That's the biggest criticism of the Greens. So I'll talk a little bit about my opinion on whether they're unrealistic policies or not, or fill in the gaps of the detail if they don't explain it properly. But point 1 there, I'm not going to go through every point, but their first point, mental health and well-being depend on the complex interactions between the social, environmental, psychological, physical, biological, economic, political, cultural, and spiritual aspects of life. That is 100% correct, and something that Australia as a whole misses in the mental health system. Australia uses the medical model, and if you see in my last video, the diathesis stress model, which is basically when people have a predisposition to mental health, and then as the stresses in their life increase, they'll cross that threshold into having mental illness problems. And then mental health is looked at as something to be cured or fixed, rather than looking at it as mental health, something that we all fit on a spectrum. So we all have some level of mental health, whether it's positive or negative, and all these different aspects of our lives impact on that. A lot of the time, and this is not necessarily a right-wing view, I don't want to put it in a box, but that individualistic view that it's on the individual to fix their own mental health or to work on their own mental health. Certainly individuals have responsibility for their mental health, but there is so many other factors involved whether someone has positive or negative mental health. And as you can see, the economic and political, especially also cultural and spiritual. That's what I'm trying to talk about in this whole show, is that mental health isn't just taking an antidepressant and not being depressed, or going out for a walk, or going to the gym and feeling better. There's so much more complexity to that. And look, at least the Greens talk about it. Whether you like the Greens or not, or think that they'll be able to achieve it or not, that's a whole other conversation. But I think at the very least, they at least understand the complexity of it. So Greens essentially want universal healthcare for mental health. So if you can see there, point 19, their big aim with mental health is to transform the entire system. Again, I like the idea of systemic change. The Greens might be a little bit more radical than I would be, because you also, when you change a system, there is that teething period or that difficult period of transition. You can't just completely rebuild a system from new in one day. There is a transition period. And I think that is where particularly Labor and the Greens disagree. Labor are much more incremental and want to do it bit by bit, step by step, which frustrates a lot of people. But that's where the Greens, what they want to do. And so if we have a look there, free and universal access to timely, public and culturally safe consultations, assessments, diagnosis and medications. So therefore, much more of a public system. They don't, I mean, in that wording, it sounds like they want to abolish the private system. As me, as a former Greens member and being a private psychologist, I don't think all Greens members would support that. There would be some level of a private system, but they're definitely more towards the public end and just having mental health care free for everybody. They do tie it to the climate crisis as well, and that's where, in terms of the economic situation, there's a term called environmental anxiety. And a couple of colleagues of mine work in that space, where the fact that, the amount of climate crises, especially in Australia, with things like earthquakes, cyclones, there was that, not a tsunami that hit Australia, but so many different things, and fires, all the bushfires and all that, how mental health is tied to the climate crisis. Their focus is also on prevention and early intervention, which I think is one of the most important things to address all the issues before they get out of control. That idea of the missing middle, before things get to extreme mental health issues, addressing that. They want targeted programs as well for communities, parents, caregivers, children, young people. So they're saying all the right things. And they talk about the workforce, they talk about suicide prevention, and postvention is basically after someone has made a suicide attempt or killed themselves, and support for the family and friends around that in the community. They want to prioritize communities, so they want safe and inclusive care, because a lot of care, and that's not even like racial or gender, it does include that, but even if you think of people living in remote environments, like people like farmers, people out in the Northern Territory, out in very remote areas, it's very hard for them to get mental health support. So the Greens, and then also justice, so essentially the universal access to the mental health services, including their legal services as well. So we can leave that there. They do have, I think as well, under here, their mental health plan. Yeah. So here's some numbers for the Greens. They want preventative and early interventional healthcare, so $400 million in grants for community mental health organisations. So that's not-for-profits. Creating the systemic approach to suicide prevention by, so they want an act, a National Suicide Prevention Act, with $180 million in investment. And then the culturally and safe mental health care, investing $15 million. And that would train all mental health practitioners in gender affirmation, anti-discrimination, cultural responsiveness. And then the other one here, which I think is another important one, is they want ADHD and autism diagnoses under Medicare, because they can cost up to or even above $1,500. And that's a lot. I know that sounds ridiculous, but through the private system, that is what it costs from a psychiatrist or even a psychologist to do that diagnosis. And oftentimes, like with ADHD, you have to do it every 3 years. So it's a huge cost for an individual to do that. And so the Greens want to put that under Medicare, which I think is a good thing. At the moment, autism assessments can be done through NDIS in a limited way. But I think that's a great one too. And also they've got a plan for counsellors and mental health nurses to be put under Medicare as well. So letter grading is an odd way to do it, but I would give the Greens an A on their plan. The reason it wouldn't be an A plus is because, not that it's light on detail, because they have the numbers and things here, but I do think their distraction or lack of focus on the private system, which is where there is so many workers, and myself being in that private system, they could address that and how that could be improved as well. With psychologists in particular, there's a 2-tiered system where general psychologists the individual gets a certain rebate, and clinical psychologists it's about $40 more. They do more training, but essentially at the end of the day, the work is very similar and the client presentations are similar, and it should be just a 1-tiered system, not this 2-tiered nonsense. And the Greens don't really talk about any of the private system at all, so that's where they would get an A from me. Now move on to, if anyone knows my favourite party, the Liberal National Party. This is the Liberal Party's website, but because they're a coalition with the National Party, it's basically the same, the policy. As you can see there, it says the coalition government. So there are facts. So there's a whole bunch of charts on the healthcare system, which I don't know if I really trust the numbers. It talks about how much they invested in the healthcare system, but it will just focus on the mental health system. So one thing that they did, and this was addressing the private sector, is so the Medicare subsidized mental health sessions. That's when, what I talked about in the last video, when you have a mental health care plan and then you get that put towards sessions with a private psychologist. In Australia, you can get 10 of those sessions a year, which is just, it's not enough. That's way too low. It's not even one a month. So people can't really survive on that if they're struggling with their mental health and they want to go through the private system. And so during COVID, the coalition government, look, I will caveat, I'll give them credit, they did do it. They were kind of dragged kicking and screaming a little bit. Things like the JobKeeper payments too, it goes against a lot of the more right wing, or the ones that are much more individualistic and don't want to increase the social welfare system. But they did do it. So they doubled that to 20 sessions, which I think is much more adequate. And through my experience of working with people through COVID, so many people utilized those extra sessions. Not everyone did, and I think that's something that can be discussed, but I think it should be instantly doubled back to 20. Labor didn't commit to doing that. There's no talk of Labor doing that, and as you can see there, they were actually the ones that brought it back to 10 sessions. And that's true. So even though I know I've talked about the Liberal National Coalition having a difficult relationship with the truth, that part there is 100% true. So they're basically going to restore those 20 Medicare sessions and have that permanent, which is good, not a time limit on it. And they talk there about Peter Dutton expanding the youth mental health service, and we'll have a look at that now, which I can say, for all my things I could say about Peter Dutton, that is a great thing. So what they're going to do is their support on youth mental health. This policy here is a little light on detail, but they want to double. So the early psychosis youth service centres, they're going to want to double that from 8 to 20. Obviously, they're not going to be able to do this now because they didn't get elected in, but at least they were talking about it, which is very important. One thing I learned, which I didn't know either, so the Headspace, if anyone is living in Australia, you would know what Headspace is. It's sort of the youth mental health centre where young people can go in and get free mental health. There's a whole range of different programs. It's a great service. That was actually established under the Howard government in 2006. I wasn't that politically active back then when I was 14, but I'd wonder if they were drag kicking and screaming to that. But look, at least they did it. And so they're talking about expanding that system as well. Another thing I want to touch on with the Liberal National Coalition, which is really important, and that they don't, this is probably more from the Nationals' point of view, who represent rural areas and farmers, that they want to support farmers' mental health as well. So they want to commit the $7.9 million to prioritise farmer mental health and set up mental health specialists in each state. Now, if you see there, it says 7 mental health specialists. So I guess they're talking about one per state. I don't know how one person can cover all the farmers in a state. So, and this is where my whole thing is, it's not enough, because 7.9 million to one person sounds like, yeah, that's a lot of money. But if that's all that's being invested to supporting farmers, it's nowhere near enough. But at least they're talking about it, and at least they're addressing it, because as you can see there, tragically a farmer dies by suicide every 10 days, which is twice the rate of the general working population. And there's a whole bunch of reasons for that, like isolation, the economic situation for farmers in Australia, so many different reasons for that. The farmers really need to be taken care of, and I really care about the farmers, because without our farmers, Australia stops. We don't. Those of us who live in the city and the suburbs don't often think about it, but where I live, right, I'm about a 5 or 10 minute drive until it starts turning into farmland. The farmers are doing it tough. They're being screwed over in so many ways by big businesses and Coles and Woolies and all that, which I'll leave for another day. But I do appreciate at least that the Liberal National Party talks about the farmers. And yeah, so here's sort of their policy. It's a little bit more detailed about their plan. So it's a $400 million investment in youth mental health. And look, again, for all my criticisms of the Liberal National Party, they at least talk about it and address it. And even though they didn't win this election, they were willing to commit a lot of money, because $400 million is not a small amount of money for that issue. I'm always going to be on the point of view that it always could be more, and we could take money from other services and subsidies for big businesses that don't need it and put it into our mental health system. But I will credit the Liberal National Party for at least talking about it and addressing it. And for that reason, I would give the Liberal Party, I was going to say a B+, but I think I'll say, no, I will say a B+, because at least they're addressing the core issue of the mental health, the amount of sessions, doubling that to 20, and addressing the youth mental health and crisis with farmers. I think those are all super important things. And I think I made a comment to someone before the election that just that doubling the sessions back up to 20 would make me vote for them. But because they had so many other terrible policies, I couldn't bring myself to do that. And the robo-debt suicides, as I talked about, if you look at it through that lens, do they really care about people's mental health? Well, that's a whole debate we could have. But at least their policies and committing that level of money was very good. And I would give them a B+. Labor Party. Now, you might be surprised my score for Labor. I think the Labor Party are woefully lacking on mental health. And the bizarre thing that I find is, because they, as you can see, they're strengthening Medicare, that's their whole thing. Anthony Albanese, almost every press conference now gets out his Medicare card and shows that off. No doubt that Labor were responsible for creating Medicare in the first place, and any kind of strengthening of Medicare really has come through the Labor Party, so they obviously will get credit for that. Their focus as well is much more on the public system and these things that they call Medicare mental health centers. So this is what they say they've achieved under their health policy. So even though they said they've achieved it, it's written as the network will consist of 61 free Medicare mental health centers and is already helping Australians have better access to mental health services. Nothing wrong with that. But a lot of these services, because they're public, there's often really long wait times. And I'm not sure, I'm considering doing a video where I call some of these services and show how difficult it actually is to get in with them. But then again, I don't want to clog up the services. So there's a bit of an ethical question. I'm deciding whether I actually sort of pretend I'm a client booking a service to show you actually how difficult it is for some of these public centers. But they don't talk about anything with the private system as well, or no kind of integration, because their other talk here is they're going to invest in that free mental health support for Australian parents, which I think is great. But again, at 16.7 million, you look at how much they're going to invest in other industries like the mining industries, and or even just the military, which I don't think we should necessarily take money from the military, but you see how many hundreds of millions they get. And then you look at that, compare it to 16.7 million, and you go, is this really enough to address the mental health crisis? They're going to back men's mental health. Again, that's my whole area that I work in, and that's amazing. But then you look at the investment again, 11.3 million for Movember, which Movember is a great organization and they deserve that money. And they're going to train primary healthcare workers. One of the programs that I can talk to is one called Men in Mind, which I'm sort of undertaking myself, and it's a pilot program to train up practitioners and mental health workers to be able to address men's mental health issues specifically, because men have a lot of issues with help seeking, ideas around masculinity, and if we pair this to the domestic violence crisis that's in Australia, it's a huge issue, and men need much more support with their health and their mental health. So I think that's great. But again, if you looked at the Liberal Party's policy of 400 million for youth mental health, and then you go, okay, 11.3 million, that's great and will make some change. Labor, who claim to strengthen Medicare, should be putting much more into it, just so much more. And then so I can already hear the Friendly Geordies viewers talking about, well, Labor has said, and here on their policy, to deliver 1 billion for more free mental health services, which I think is great. And then we can see the breakdown of that here. So it's going to be 225 million for 31 new and upgraded Medicare mental health centres, which, look, I don't think they're bad, but I'm a little skeptical of the quality of their services. And then 200 million for 58 new upgraded or expanded headspace services, which is great. Then 500 million for 20 youth specialist care centres for young people with complex needs. And then 90 million for more than 1,200 training places for mental health professionals and peer workers. And then you can see there some of the stuff that they've done in terms of free mental health care. So look, I think it's good on paper, and they do address there the missing middle, the service gap as well. But the thing is, it's all public and no private. And similar to the Greens, at least I think the Greens addressing it systemically, Labor's investment all seems to be in these, as you can see, like these public centres that just from the work that I do and what I know is not always the best in terms of their quality or accessibility. So Labor, I think, will get, I want to say like a C+, because I think the funding seems good on paper, but I'm very skeptical that they're actually going to deliver on these expansions and actually address the issue with the private sector of those mental health subsidised sessions, because Australians should have that choice, and it should definitely be more affordable, and that's where the government can come in, and that's what, with a social democracy or social democrat approach that I like to take, is that individuals should have a choice. It's a hybrid of public and private, and the public and private should be well funded from the government, especially in the area of mental health. And because Labor doesn't really address that at all, I can't really give them into the B or above range in terms of a letter grade. All right, and then we'll just look at a couple of others. So I'm not going to go through all the independents, and because we've got the Teals, but they're not technically a party, I'm just going to point out one politician, Dr. Monique Ryan, who's an independent federal member for Kooyong in Victoria. And here is the key wording, which I think takes it even further than the Liberal Party, and something that I think is amazing is advocating for those better fund allied health services. And allied health means anything sort of around the doctor. So that includes like physiotherapy, psychology is included in that, and mental health. Dr. Monique Ryan has said, don't put a quota at all. We don't ration GP visits. So you can go to your doctor and claim Medicare as many times as you want throughout the year. And then with Medicare, why is it only 10 or even 20? So the Liberals are saying 20, why even that? Let's just take the cap off it. And look, that's awesome. There's not much other detail pointed out in terms of the public sector from Dr. Monique Ryan, but because if you look at overall her point of view on expanding services, I would give her an A+ just for taking that cap off altogether. I would have said, if you could give it, like for my choice, I would have said 40 sessions a year, because that's in line with the eating disorders sessions that you can get. And I think most people won't use that many, but the people who need it can use it if they want. I think 40 would be a great number, but why have a cap at all? It doesn't, when you actually compare it to other services that don't have a cap, like going to the doctor, why have that at all? So just for that bold idea itself, an A+. And then our last one we'll quickly have a look at is our friend Pauline Hanson and One Nation. And look, we can say whatever we want about their immigration policies and all of that, but there's an article here from one of their members, who I believe is actually a South Australian state politician, secured $100,000 from the Labor government to support a suicide prevention fellowship in men's mental health, which I think is great. And this is not necessarily a policy statement, but I guess they do have a couple of things here. One thing Pauline Hanson and the One Nation Party talk about is the men's mental health crisis and the suicide crisis. If you're looking at 2023, more than 2,600 Australians took their own lives, and that's double the national road toll of that year. So more people, like double the amount of people die by suicide than on the roads. And that and the effects, and this is what One Nation talk about, what they've put in there. It's not just the person who did it, but it's their friends and families, everyone affected by it. And more than 90% of those suicides in 2023 were men and boys. So there's a huge gap in that suicide rate. And that's not to say we're going to diminish or not focus the importance on women's mental health, which is equally as important. But this suicide rate is a particular issue for men. And as you can see there, Senator Pauline Hanson wants to appoint a minister for men. Now, look, I think that's great as well, because I believe there is, it says if we have a minister for women, gender equality demands a minister for men. My whole thing about the everyday Aussie theory, it's not about what about me and competing, but I think it's very fair to have a minister for men and someone that focuses on men's mental health issues, because addressing that will largely address the domestic violence crisis and a lot of other crises we're having in our country. So look, One Nation, because it's very light on detail and they don't really talk about the public or the private system, look, at least they talk about it, and I would give them, let's give them a B as well, and see how they go on their policies, or at least I think the role of One Nation is, because they're in the crossbench, they can heavily, like what I think the independents can do, is hold the Labor government accountable on their policies, even though the Labor government hasn't claimed to do anything around the private system. I think independents in the crossbench can focus heavily and don't stop talking about the mental health crisis. And so that's the video for today. I hope it's been engaging. My name is Nathan Ogilvie. This podcast is The Rightest Leftist, the podcast for the politically homeless. Please like, comment and subscribe on all the channels, and I would really like to hear from you about your experiences with the mental health care system in Australia, if you have any experiences with it, and any ideas around future videos on this system, anything you want to know or want me to talk about, because my third part, I'm going to go a little bit deeper into some of the issues around the system that we've currently got. And so I look forward to seeing you in that future video, and thank you.